Now, today is World Cancer Day. This year's commemoration is on the theme Close the Cancer Gap. Instituted in 2000 to be held every February 4th, World Cancer Day is a global initiative led by the Union for International Cancer Control to face one of the world's greatest health challenges. But what can be done to reduce this global threat, and how can we keep staying healthy? Joining us via Zoom is Dr. Jemofu Opong Mensah of the Komfanochi Teaching Hospital Cancer Unit for some education. Good morning, Doc, and thank you so much for your time. All right, Doc, can you please unmute for us?
Good morning.
All right, thank you very much. Thank you very much for your time. Now, what should we be wary of as far as cancer is concerned?
So when we talk about cancer can affect anyone. And the main issue with cancer is that it's actually the leading cause of morbidity and mortality worldwide. Mm-hmm. And since cancer is no respecter of persons, everyone, I think, should be wary of it.
Yeah.
Basically, what you want to avoid is that since we can't really control who gets it and who doesn't get it, you want to make sure that if you get it, it's detected early. So early detection is key.
Yeah.
Again, one of the things that we should be wary of is our lifestyle, because cancer is generally linked to. So when I say cancers in general, mainly adult cancers are linked with some of our lifestyles. So we should be wary of what we eat,
yeah,
our daily activity, and then we should, of course, also check our body weight. So those are some of the things that we should take care of, because there are risk factors for cancers, usually in adults.
All right, so now let's bring this home. I understand that there's an increase of cases of childhood cancer cases in Komfanochi Teaching Hospital. What could be the reason for this?
Okay, so for the increment, I think it's because now, unlike earlier on, we didn't have the personnel or the skills, so the specialists to help us detect it early. Now, more or less, we are able to make accurate diagnosis. So that can be one of the reasons why we have more cancers. And of course, cancer is linked with childhood cancers. They be linked with some diseases like HIV, like hepatitis B, and some genetic predispositions. So of course, we are picking it up early, and then because of our lifestyle changes, could be the reason why we are seeing more of such cases.
All right, this year's theme.
Facility in Komfanochi.
All right, now this year's theme is Close the Care Gap, and there's always a conversation about how expensive cancer treatment is. So how are we closing that care gap in Ghana?
Okay, so in Ghana, if we really want to make an impact and we want to move forward, then all stakeholders should come on board. When I say stakeholders, mainly the government, the doctors and nurses who are trained in cancer care, the hospital management, everyone, and then the leaders in the community. We are all supposed to come together to close the gap, because cancer treatment is such that, for children, the commonest cancer we have is cancer of the blood, that is the leukemia. To get the full treatment would take about, let's say, 2 to 3 years. To get the whole treatment, one would have spent close to 60,000 Ghana cedi. And that's a lot of money for even a middle income individual. Yeah. And then they usually have people in Ghana usually have more than one child. To spend the amount on one person. So cancer is childhood cancers especially, is one of the diseases that should be on the National Health Insurance Scheme. Because when you go elsewhere, where they are actually putting in strides and efforts, trying to make an impact or trying to close the gap, cancer care or cancer treatment is not the burden of an individual, it's the burden of the nation.
Yeah.
So of course, it should be on National Health Insurance. We are not doing that. Mainly we get our support from World Child Cancer, and then from individuals, organizations, and some companies in Ghana. That's what we do. And then another thing that we are trying to use to close the gap is early detection. So what we do is that on a day like this, we educate the public that both adults and children can get childhood cancers. If you have any disease or any symptom, or sign that is persistent in your child, let's say your child is getting a fever, you've been to the hospital, you've been treated, the child has been treated for malaria, maybe a couple of times, but it's persistent or it recurs. You would want someone else to screen the person to know if it's an early warning sign for cancer. So we are actually basing what we are doing to close the gap is to educate the public more so that they come early. Because if you come early and it's the childhood cancer, 8 out of 10 children survive if it's detected early and timely and appropriate treatment is given to such an individual.
Now, previous campaigns have called for joint efforts between government, NGOs, and civil society organizations, to first of all promote the action, promote action and investments. You just mentioned that cancer treatment is still not on national insurance. Are there any conversations happening to make sure that it comes on the national insurance? Like what is happening there when it comes to cancer treatment and investing into the cancer treatments as from government side or government's point of view?
Okay, so I know that during the latter part of last year, some conversations went on and some cancers, common cancers in children like the leukemia, the lymphomas, and some cancer of the kidneys, there were talks that it will be put on national health insurance. In Ghana, everything takes a while, so I'm sure it's in the pipeline, but as of now, it's yet to be on the national health insurance scheme. But I know it was approved to be put on. On a day like this, all we can say is that we ask that the government facilitates it so that a lot more children will benefit from cancer treatment, appropriate cancer treatment through the National Health Insurance Scheme.
All right,
I know talks are yet to come to reality.
All right, so aside from investment and calling to action, what are some of the challenges you are facing at the cancer unit?
Okay, so on a typical clinic day, when you come, if you haven't been there before, the first thing that will strike you is that these are a lot of patients in a small area.
Okay.
So we don't have where we work. Now we have a lot of patients. I think last year we actually saw about 100 to 150 new cases.
Yeah.
And then we already have our old patients. And so the place is crowded. It's too small to accommodate the number of patients we are dealing with. That's one of them.
Okay.
Number two is the skilled personnel. When it comes to cancer, I think World Child Cancer is doing a lot more for us than what we are getting from our government.
Okay.
But actually ensure sustainability in any program, it should be something that the government is taking up or the main stakeholders in the particular country is taking up, but it's not so with us. However, we have quite a number of doctors and nurses who have been trained by World Child Cancer to help manage these children. But it would be better if the government was taking training of doctors who are skilled in delivering cancer treatment. If it takes it up, it will be better because then you have more people getting into such training. So I'm basically saying that the number of people who treat children with cancer is not adequate compared to the number of patients we have. Number three, of course, I always say money, because when it comes to cancer, if you don't have money and you even have the skills, you will still be handicapped.
Yeah.
So money is one. It's on national health insurance. It might not even be enough. We may also still need companies, individuals who are well-to-do in the society to take it up. People say that cancer is a disease that should be managed by a village, so it should just be so.
Yeah.
And another, one of the things we also battle with is stigmatization. I remember yesterday at the clinic, a mother asked me, she was having a symptom, which she complained to me about, and she was asking, "Doctor, is it because my son has cancer? Is that why I'm also going to get cancer?" Yeah. She was asking if it was communicable. And she also wanted some of them also don't want their colleagues at work to know that their children have cancer, because they believe that if they they get to know, they will stigmatize their children. So we are also battling with stigmatization. And of course, you know, in our cultural setting, our way of thinking, most things are attributed to, you know, witches and then the devil and stuff like that. So people prefer to seek treatment from, you know, unorthodox,
like traditional doctors.
Exactly.
Yeah.
So through the cures and no. So by the time they come to us, it's basically too late. But for childhood cancer, the main key is early diagnosis. If you diagnose the child early and you offer the child appropriate treatment, you are more or less able to achieve a cure. So those are some of the challenges we are facing.
All right. So it's skill sets, it's space, and also obviously the most important one or the most obvious one is money, money, money.
Of course.
All right.
Exactly.
All right. Thank you very much. That is Dr. Opomense of the Kofonochi Teaching Hospital Cancer Unit, and she's been giving us some education on cancer, seeing that today is World Cancer Awareness Day. And because it is that day, we, the Multimedia Group, are giving out mammogram vouchers on all our platforms. These vouchers are for women 40 years and above, so all you need to do is get to our front desk for yours. We're grateful to our partners, Roche Products Limited, for supporting this initiative, and International Maritime Hospital, the designated hospital for the mammogram examination.